Muskegon. Are you awake? All right. My name is Linda Juarez, and I am the CEO of Hackler Community Care Center here in Muskegon Heights. I'm also the co-chair of the 1 in 21 initiative that we're going to talk about today. I think we're going to talk about it today. Well, I will tell you a little story as we're waiting for this. I am from San Francisco and relocated here to Muskegon, and love San Francisco, but really love Muskegon. Yay! County Health Rankings. It's a model of health that emphasizes how we can create healthier communities to live, to learn, to work, and my personal favorite, to play. You may have heard of County Health Rankings. It's getting a lot of play in the media on the national level. Governor Snyder, for example, has mentioned the County Health Rankings in his health and wellness dashboard. I even read about it in People magazine last week. So people across the nation are figuring out creative ways to create healthier communities. What it is that the University of Wisconsin Robert Wood Johnson Foundation nationally set up a study that compares counties to counties within a state and across the nation on health behaviors, health factors, health outcomes, including tobacco use, alcohol use, diet, exercise, safe sex, a number of different factors. They also look at access to healthcare services. And Muskegon ranks one of the highest in the state of Michigan for access to healthcare services. Woohoo! But are we healthy in Muskegon County? The answer is not yet. Just to give you an idea, Muskegon currently ranks 64 out of 82 of Muskegon or Michigan counties for poor health. We're not at the bottom, but we're close to the bottom. Let me give you a little bit of perspective. Muskegon is 64, as I said, out of 82. Ottawa County is number 1 in health outcomes. Our neighbor right next door is number 1, and we're number 64. What does that mean? It means our neighbors are healthier than we are. Because 1/3 of us smoke, and 1/3 of us are obese. Those are two of the key factors that affect health outcome. They're two key factors in cost, hospitalization, and health outcome. Well, who cares? Why is that important? Well, first, on a personal level, if taking care of yourself or a family member or possibly someone else in your family, that has a huge toll. But even as important is that good health in a healthy community thrives. Good health is the absolute foundation. First of all, it's the foundation for academic achievement. Poor health, physical and mental health, is linked to academic failure. Students are unable to pay attention in class, they have poor test results, their grades are poor, and they have poor school attendance. Also, health is a foundation for economic prosperity for a couple of reasons. Poor health costs more money. On a national level, our healthcare costs are escalating at an unbelievable rate. Who pays for that? We all pay for that. Another way that good health is the foundation for economic prosperity is that existing employers in Muskegon, as well as new employers who want to come to Muskegon, they want well-trained, educated, back to that academic achievement, healthy, productive employees. They want to know that the community that they're coming to creates or offers a quality of life for them. So, where do we go from here? We know that Muskegon County is one of the unhealthiest counties in the state of Michigan. We know that good health is the foundation for academic achievement and economic prosperity. So, the 1 in 21 has a vision that Muskegon County will be the #1 healthiest county in the state of Michigan in the year 21. We have 10 years to do it. 1 in 21. Can we do it? Well, it's an audacious goal. I've been accused of being audacious before. This is not the first time, I'll have to admit. But Muskegon has a history of coming together as a community. And in this case, in the 1 in 21 is exactly what happened. The Rotary Club of Muskegon pulled together a collaborative cross-sector of leadership and action. And really what Rotary did is it brought together the Community Foundation and United Way and schools and businesses, community agencies, faith-based organizations, and individuals just like you. You're the question mark in the middle. And brought all of this cross-sector of leadership and individuals together and said, this is a call to action, that together, we can help all of us in Muskegon County, yes, 175,000 people come together to lead healthier lives. So, the way that we're doing it is one of our values, or two of our values, is inclusive participation and reducing health disparities. Now, we didn't set out to say, okay, we're going to start a whole bunch of new initiatives. We really want to build on all those fabulous things already happening in Muskegon. And we are doing a couple new initiatives as well. For example, Access Health and the Employers Association and United Way for years has been doing the Corporate Cup. Have you heard of the Corporate Challenge, Corporate Cup? Where businesses really compete with each other to support healthier employees. Another example that's been going on for years is the Muskegon Community Health Project has a childhood obesity collaborative. They work with kids and families to support them in creating healthier lives. Another one of our values is evidence-based best practice. We don't want to just do a bunch of activities. We want to know that what we do makes a difference. So we've researched, we've looked at other communities, we've stolen from everyone we can to make sure that the activities and initiatives that we do really make a difference. For example, we have a school committee who's creating a community-wide school plan that will include healthier lunch options. Chris Bedford would be thrilled as one example. They also are looking at getting 2,100 students to participate in the Seaway Run this summer. That's more than double what Seaway Run has done in this past year. Audacious? Absolutely. Another example of that is the healthcare providers and the recreation and fitness clubs are starting a community challenge to all of us, all of you, which is to lose 21,000 pounds in 10 weeks. That's 10 and a half elephants in 10 weeks. So the way that, just to have a picture in your mind, the way that they're looking at doing it is that if each of us lose a pound, as a community, we can lose 21,000 pounds. Another couple of our values is that efficient stewards of our resources, and also that it's sustainable. We are not a wealthy community, but we have great resources here. So we want to make sure that whatever we do really efficiently uses those resources that we currently have. We also want things that will be sustainable, that our children and our children's children will be able to live and thrive in the community that we create today. Some examples of that. The Chronicle, I think it was mentioned or reference to MLive. You may have heard about the launch they did for the MLive blog for the 1 in 21. First time ever that on MLive you as consumers, all of you, can add your content, your ideas, your articles about healthy living and how to create a thriving community. So we welcome those inputs. Our infrastructure subcommittee is looking at our roads and our bike paths and our walking paths and really creating an environment, drawing on this beautiful lakeshore that we live on, and building a community that really helps us to live these healthy lives that we need. And then finally, our community engagement community, faith-based organizations, individuals are setting up nutrition education and community walks throughout our community, from Montague to the Heights throughout our community. And these are just a few examples of the kinds of really exciting things that we invite you to participate. There is something for everyone in this initiative because a healthy community thrives. And a healthy community starts with each one of you.